Have y'all seen this? I've heard of superwoman, but what's a super female? Welcome to She Knows DNA. My name is Miavonna, and I am a board-certified genetic counselor. Yelling all the way to South Carolina, this video is dedicated to my little cousin, Jalen. So in the past, it seemed as if you all really liked my content, especially the ones that were talking about DSDs or differences of sexual development. So with that being said, I got another one for you. Are you ready? Let's get into it. Now, if you remember from my previous videos, there are 3 categories that fall under DSD. Today, we will look at category 1, where there is a difference in the number of sex chromosomes. So, talking about category 1, yes, that does mean there can be too many or too little amount of sex chromosomes in the body than we would typically see. Remember, for those that are born female, they have 2 X's, and then those that are male have an X and a Y. With that being said, have you ever heard of a woman having 3 X chromosomes? That's right, not 1, not 2 like we would expect, but 3. This condition can be written out in multiple ways. So you may see this written as 47XXX, trisomy X, or triple X syndrome. This condition is only found in females, and that is because, as you can see, there is no Y. Remember, if there is a Y chromosome, then that makes that person a male. What causes those 3 chromosomes to be present rather than 2 is really an error during the meiosis phase. Remember, meiosis is essentially the cell division. So we are dividing those cells of the egg and the sperm. But in the case of triple X syndrome, some of those chromosomes did not want to divide, and now they have the numbers all messed up. This error is a random occurrence, meaning that there is not anything anyone did or anything that was inherited to that baby. However, one of the risk factors that is associated with trisomy 8 is advanced maternal age. That's when you're 35 years or older by the time the baby is born. And so essentially when we think about causes in that case, it's the same thing as like whenever we're looking at Down syndrome, which is otherwise trisomy 21. But again, even with that risk factor, it doesn't matter how old you or the dad is, there's always a risk to have a daughter with 3 X chromosomes. Triple X syndrome occurs in every 1 in 1,000 female births. What that essentially tells me is that there are a number of people walking around on this earth with 3 X chromosomes and they have no idea. There are many females with triple X syndrome that either have unnoticeable signs or their features are very mild. Of triple X syndrome include the following: being taller than the average girl at that age, having folded in eyes, their eyes can be spread wide apart, their pinky can be curved, they can be flat-footed, their breastbone is inward, so it's like a bold shape, low muscle tone, seizures, problems with the kidneys. Their ovaries could be troublesome, especially having signs of premature ovarian failure. There's also some psychological symptoms that they may experience, and that's things like developmental delays, speech delays, motor skills, and like those fine and gross motor skills. There can be signs of anxiety, depression. There can be learning difficulties, especially with reading and math. And then persons can also have ADHD or some kinds of autism. As you can see with those types of features, all of them pretty much are things that we see throughout society, throughout people in the United States, and I'm sure even other countries. So there's nothing specifically that'll make you think, I think I have triple X syndrome. And then plus, remember, it varies from person to person, not only the type of features that they have, but the severity of it. So it can be really hard to tell. And the only way to fully confirm this is doing genetic testing, to where we look at the chromosomes, count them, and to see how many you have. I know in my experience, the patients that did have triple X syndrome had no idea, of course, before I tested them. And then our reason for testing was maybe they were having some trouble getting pregnant or even keeping the pregnancy without having an early miscarriage. But remember, everyone who has triple X syndrome is not infertile, nor do they have difficulty getting pregnant. So that's also another way that this is pretty hard to catch without doing specific genetic testing. Those with XXX syndrome can absolutely live a normal life. And the thing is, as far as treatment is concerned, that's individual based essentially. So just make sure you talk to your doctor. That way they can do a full physical exam and other testing on you. That way, treatment wise, they can meet your needs. But with this condition, there is no cure. So that's why the management is going to be more specialized. Now, there may be some of you all in the back that's still trying to figure out why I titled this video Super Female. So let's talk about that. Let's say for entertainment purposes that the Y chromosome is the boy chromosome and that the X chromosome is the female or girl chromosome. So if a female has more X chromosomes than we would expect for a typical female, you tell me what you would call them. I think super female is an appropriate name. Long story short, I think we have figured out how many chromosomes Superwoman has. Let's say, it's obvious, right? What you think? And now to leave you with words of wisdom. So let me tell you, we have a couple of members in the D9 sororities and fraternities in my family. So I am a member of Alpha Kappa Alpha Sorority Incorporated, and I have my aunt Reva, who is a member of Delta Sigma Theta Sorority Incorporated. So as she told me after I crossed AKA, knowing that I got a scholarship from Delta Sigma Theta Sorority Incorporated while I was in high school, you need to give that money back. Why would you take that scholarship money knowing you wasn't going to be a Delta? I want my money back. Now I'm going to let that sit in y'all spirit, because whenever I applied for that scholarship, in no way, because mind you, I was in high school, it didn't have in the fine print, if you accept our scholarship, then you are saying you want to be a Delta. They didn't say that. Because I would have told them that I didn't want to be a Delta. I always knew I wanted to be an AKA. So what do y'all think? Should I give that money back or no? I did not give it back, but Reva seems to think differently. I'm going to let that sit in y'all spirit and y'all tell me what you think. Well, guys, that is all I have for you. Thank you so much for continuing to support my videos. Oh my goodness, this has been a journey, but y'all, we are just getting started. And speaking of the journey, I have a special video that is coming up, but I may need some of you all's help. So if you want to know what this special request is and want to participate, in the comments, I need you to comment the numbers 22, okay? 22, put those in the comment, and then I will follow up with messaging you what I need help with, okay? Can y'all do that? Amazing. Well, God bless you and God keep you. Please be sure to like, comment, subscribe, all the things, and I will see y'all next time. God bless you and have a good one. Bye.